Well, I'm Allison Poole with the University of Iowa Police Department, and go ahead and introduce yourself.
I'm Carrie Neblett with the Crisis Center of Johnson County.
I'm Jessica Peckover with Johnson County Jail Alternatives.
All right. So the reason we're meeting is to just have a little bit of dialogue about the Johnson County Mobile Crisis Outreach Unit. And so I'm interested in finding out what is it?
So mobile crisis outreach is 2 behavioral health professionals will go out. They're going to be available 24/7. A phone, anyone in the community can make a referral. They would call a dispatch number, which is being dispatched at the Foundation 2 call center in Lynn County. The Foundation 2 call center will then dispatch the on-call mobile crisis outreach counselors, which again is 2 behavioral health professionals. So they will then get together, and then those 2 counselors will go out on scene and try to de-escalate the situation, provide support counseling, assess what's going on, and then make appropriate referrals. So the ideal goal is you keep them in their home, you're able to give them the supports that they need, give them some resources to help eliminate or decrease the crisis that's occurring. The hope is that we can reduce unnecessary ER visits and help law enforcement, reduce the number of arrests that could have been diverted if there were other resources that had been available.
That makes sense. So what would a typical call look like?
But we can speculate. I mean, I'm sure you could come up with about 5 times that in the past week, that patrol could have used a behavioral health professional on scene. So it can be things like parent-child conflict is happening, they need some mediation. It could be an individual with a mental illness who is experiencing some sort of crisis. Their symptoms have increased, or something happened and they're not able to problem solve it on their own and they get to a crisis situation. It could be somebody who's experienced unfortunate news. Something bad happened, they're losing their job, they're going into foreclosure, they've lost a loved one, anything there could be a variety of impetus to the crisis, but the person has reached the point that they're emotionally intense to the point they can't really problem solve the situation on their own.
So what I'm hearing is that the person does not necessarily have to be acutely suicidal in order to call for your services.
No, they might be suicidal. That's a good point. I didn't even hit on the big one, is that somebody who's suicidal would be an appropriate mobile crisis call. If they've already attempted suicide and need medical attention, then that would be something that you need to call 911. That would be a first responder thing. But if it's somebody who's considering suicide, the mobile crisis would be able to go out and assess the severity,
And so it's also my understanding that you will not respond to a violent situation, right?
Right. If the person is violent, or if there's weapons involved on the scene, that's a situation where law enforcement would be the better place to call. Once law enforcement has secured the scene, we would be able to go out at that point.
Okay, so could we at least call you to make you aware of the situation, just put you on standby?
Oh, certainly.
If the status changed, then you'll respond if it's safe to do so.
Certainly.
Now you have beds. What are these beds about?
There's going to be 2 crisis stabilization beds in Johnson County, and those are for people who are in a crisis, who need to be in a safe place for 1 to 5 days, that don't necessarily need to be in a hospital. So if they're maybe feeling suicidal, but not to a point where they feel like they're going to kill themselves, but don't feel safe home alone, they can go to these beds just for a time to rest, to think about things, and have somebody watch over them for a while, help connect them to community resources.
Now, who can call the mobile crisis unit? Just law enforcement?
Anybody.
Anybody?
Yep, anybody can call. It can be a self-referral, it can be school districts, it can be law enforcement, the hospital, families, teenagers.
See, you mentioned school district, teenagers. So there's no age limit?
No.
For Well, that's good to know.
And that service is only available, you asked about ages, the crisis stabilization beds are for individuals 18 and over. Mobile crisis outreach is available to all ages. Adolescents and juveniles are included in that, as well as adults, but the beds are only available for adults. There are other shelter resources available for the juveniles if needed.
Okay. And this is also, you do this in cooperation with other crisis type facilities, like from other counties, other...
Sure, the whole project is a regional, if you're not familiar with mental health redesign, we're within a 9-county region, the East Central region. So this is being funded by the East Central region, and the idea is that there are mobile crisis services available to all 9 counties in our region. Those are made up of different teams, so the Johnson County team will respond in a 60-minute call radius. And the partnership with I think you're maybe referring to is with the beds. We have 2 beds, crisis stabilization beds in Johnson County. If those are full, there are a few other beds throughout the region that we can partner. So there are a couple beds in Lynn County, so we can see if their beds are full. If ours aren't, they're going to be in March sometime. A couple other beds in Independence and in Dubuque. And so if theirs aren't full, we can maybe utilize those resources as well, and vice versa. So if Dubuque is full and they're trying to find a bed, they could potentially use a bed in Johnson County if ours were open.
It may take up to an hour for the counselors to arrive, so I think it's important for people to know that it won't be as fast as law enforcement getting there. But we will show up and have people there to care for the people.
All right, so that makes a lot of sense. The response time definitely depends on the location, where you are relative to that person, and also whether or not you're already gainfully employed dealing with another client or potential client. So Carrie, how would I contact the Crisis Mobile Unit?
So anybody who wants mobile crisis dispatched to a location where there's a crisis can call 1-855-800-1239.
Okay.
And they will be asked a few questions about the situation. The phone counselors will make sure that the situation is safe for the counselors to go out to, and then they'll dispatch the counselors.
Now, besides calling, may I text? May I get on the website?
For the mobile crisis, you do need to call.
Okay.
But I think you're asking about, there are a couple other crisis options. If somebody, we have crisis hotlines where you can call in and talk to somebody. In Johnson County, we also have crisis texting and crisis chatting on the computer. So there are several resources that the Johnson County Crisis Center has for people who are in crisis. Is that maybe what you're asking about?
Yes, I am.
Okay. So if you need mobile crisis, to be clear, if you need mobile crisis outreach, you call the 855-800-1239 to dispatch mobile crisis. There are some additional resources. If you come up on somebody and you know that they just need some additional support and you want to give them a crisis hotline to contact, we have phone crisis hotline, text crisis hotline, and online chatting.
And of course, they know to refer the call to the mobile crisis unit.
If it got to that point, yep.
Right.
Yep.
So if you want to text in for help, it's 1-855-979-8255, and that's available from 2 p.m. to 2 a.m. And to chat online through instant messaging, it's iowacrisischat.org. And that's also available 2 p.m. to 2 a.m.
So at every turn, there's multiple resources available for someone that's under duress, that believes that they're in a crisis, or someone that's dealing with someone that they believe is dealing with a crisis. They can call, text, whatever means that they have available to them to get help.
Yeah, we're really trying to expand crisis services to sort of be across the spectrum at their level of need. And a big piece of this is retraining providers, retraining the community, that rather than calling 911 for law enforcement anytime there's a crisis, now if it's something that's more of a behavioral health crisis, there's another option. So if you're feeling suicidal, if you're feeling overwhelmed, if you're dealing with a crisis with a child, rather than calling 911, you could try to call the mobile crisis and have behavioral health professionals try to dispose of the situation rather than having to dispatch law enforcement.
I know from the perspective of law enforcement, it doesn't matter if if the person believes, or if there's a perception that they're under crisis and they feel the necessity to call 911, we really don't mind. Mm-hmm. So I understand that you made an effort to make contact with all the law enforcement agencies in the county to make them aware of the program, mm-hmm. so that they know to actually redirect the call if necessary to contact you guys.
Yeah. Or if they're on scene and they decide, wow, this is really something that'd be nice to have a behavioral health professional to assist with, then the law enforcement on scene, they could dispatch the mobile crisis team.
So what information, if I'm calling on behalf of someone, what information could I provide to actually help?
We actually, Carrie developed this one-page handout that gave to provide some guidelines for law enforcement specifically. They would kind of walk through some of that, so I can just read off of here. Some of the details that the officer would be asked about when calling mobile crisis would be the nature of the crisis, what's the crisis situation that's going on, the location, obviously, if we're going to go out, medical condition, does the person need immediate medical condition? If so, that needs to be taken care of before we can go out, and to let the mobile crisis dispatch know if there are weapons present.
Wow, so that's similar to the questions that we ask in law enforcement.
Right. Mm-hmm. So you should have all the information. Yeah. It should be easy to make that. Mm-hmm.
And I think in addition, sometimes we'll even ask, does the person have a history of mental illness, or is the person on medication? Mm-hmm. Are you aware the last time the person had taken their medication? Right. And things like that definitely helps us out as I assume would definitely help you out as well.
Mm-hmm. Yep.
Well, great. I thank you for your time to visit with us about this very, very, very important and, I believe, beneficial service that you're going to provide to our county.